National Education, Health and Allied Workers Union is forging ahead with its planned national strike. It commences tomorrow and will run indefinitely until government accedes to its demands. For more on this, I'm joined now by NEHAWU's Deputy General-Secretary, Mavuso. Good evening and thank you very much for your time, Mr. Mavuso. Let's talk then about the process that you have undergone so far as far as preparing for this strike. You have done what the law requires as far as balloting is concerned, and what has been the response?
Yes, good evening and thank you very much. Yes, we actually been preparing for some time now. Our members who are committed workers have been mobilized throughout the period of lockdown. Remember that they are part of the frontline workers that were, in the battle against COVID-19. They've been subjected to very difficult conditions, working in the rain, in the sun and so on. So they've been mobilized, but they went ahead to do all that work, put their lives at risk, despite the fact that they've not been permanently employed. Their conditions are very bad, despite the agreement that was signed with government. So we, for the past 2 weeks, we had asked our provinces to ballot all members to participate in the strike, and the response has been overwhelming. We are more than ready. We've just made an assessment this morning. All provinces have confirmed that it's all systems go.
So are you saying government is now doing an about turn on this agreement? Because, 5 months ago, for example, the MEC for Health, then who was still on before his suspension, Dr. Bandile Masuku, confirmed that about 8,500 community healthcare workers will now be made permanent and will actually come into the payroll as level 2 workers in Gauteng. I'm not sure what the situation is in the other provinces. So to an extent, government acknowledging that community healthcare workers are a foundation to primary healthcare in this country. What is giving you the sense and the feeling that government is now doing an about turn on that commitment?
Remember, long before Bandile Masuku, as the MEC of Gauteng, made that announcement, we had agreed in 2018 in the Public Health Sectoral Bargaining Council together with government, where we signed an agreement that within a period of 12 months, we will work jointly on the modalities, standard operating procedures, and conditions of service in which community health workers will be permanently placed. And the 12 months came and gone. The agreement was signed in 2018, while in 2020, nothing of that sort happened. They sought, to extend that agreement. Even today, they wanted to extend. As how we refused that we can't extend this agreement, indefinitely. We have to put this matter to finality. So when Bandile Masuku made the announcement, it was outside that framework that we were supposed to develop together as parties in the council. So he made an announcement, which was good. We appreciate that, welcome that at least there was an attempt from Gauteng to permanently place these workers. But the conditions, the salary level, is not something that we determined jointly as it was envisaged by that agreement we signed in 2018.
Now, why is this important for you? Previously this matter, since as early as 2016, in fact, community healthcare workers have been part of the health response in the country since the 1990s to respond to the HIV/AIDS crisis. But going back and forth in the court started, as early, one would say, as 2016, where this particular issue was ventilated, and government then believed that community healthcare workers are not an employment program, but actually they are a training program to train communities on primary health care. Of course, they've since come around and recognized their importance. Why is it important that they be absorbed into the permanent payroll of Department of Health?
Look, the World Health Organization and many countries have recognized and accepted that if you want to build a strong primary health care system, you need community health workers because of the work they do that can be done by nurses and other healthcare workers. Government in South Africa has not been taking this serious, and it's a campaign ourselves we've been waging for many years. Now, in the build-up to NHI and the white paper on NHI, there was a recognition, this matter was brought in the NHI teams, the ward-based primary healthcare teams. If you look at the NHI document, you find that amongst the categories of employees in that team, it is community health workers. So it is built in that system. And that is why, therefore, it is important to permanently employ them, better their working conditions, because they'll be working with the rest of the healthcare professionals led by a professional nurse deployed in each and every ward in terms of NHI. So you cannot, therefore, have the rest of the healthcare workers permanently employed with better work conditions. You still subject these community health workers to stipends, payment, short-term contracts, and all the hardships that they go through on a daily basis. So it's quite important because they are part of the backbone of the system at the primary healthcare level.
Talking of those short-term contracts, now previously governments attempt to, for example, force the community healthcare workers to renew their contracts. They've said, well, they're putting new conditions in place, something like they need to have a grade 9 qualification in order for them to be enrolled or to be given that kind of contract as service providers. At this bargaining council, have you come up with the criteria and conditions that would need to be fulfilled by those who are going to be absorbed on a full-time basis?
Those are the things I'm saying. We had agreed we must work on within a space of 12 months, including what you do with those workers who've been in the system for many years, but they don't have metric, for instance. We will consider RPL and, training programs, reskilling, and all of those things. We were supposed to deal with all of those details. And unfortunately, government did not come to the party, to make sure that happens.
Now, of course, we are in the midst of the pandemic and COVID-19. It's still out there, and community healthcare workers have proven to be quite crucial, as you mentioned earlier on, with all the challenges that do exist there. How is this strike now going to affect those services?
Well, it is unfortunate that in a strike, obviously there are inconveniences. We know that, for instance, there are many of these community workers who are today deployed in schools, wherein they assist the education department to screen learners as and when they come into schools, but they're also doing contact tracing and so on. So that will be impacted by the strike. But these workers are sacrificing. They've been sacrificing a lot. At least they deserve better.
And by better, what are you putting as a list of demands as you're embarking on this strike?
We say employ them permanently, at least at salary level 3, in terms of the public service salary levels that are applicable, which is still very low. But as a start, we say place them at salary level 3, unlike how they did, where they place them at salary level 2. And we've been having a discussion in the public service to abolish those salary levels because they are really not assisting. We're saying give them working tools, including transport, because they travel, they go to the rural villages, they go to the townships, they walk through the rain, when there's heat and so all of those things. Give them working tools, give them cell phones if they have to be given cell phones for them to be able to communicate and all of those things. So those are the things that they really, but the first thing is permanently, give them permanent contract at salary level 3. And we deal with the rest, of the conditions of employment.
Do you think it's a realistic demand, considering that already Treasury is ceased with the conversation around cutting the public sector wage bill? Will this not be adding more of that burden that we are having conversation around cutting back on?
Well, the debate by Treasury or the argument by Treasury is not something all of us agree with. So we cannot say, because this is what Treasury says, that the public service wage bill is too huge, therefore it must be accepted as such. We still maintain that that is misplaced, but that's a debate for another day. The President has just announced the employment of 6,000 community health workers and nursing assistants for the next 3 years. We think it's possible, but we're also reminding the government of the ANC of the commitment they made during the manifesto in 2019 elections, that they will work to absorb about 50,000 of the community health workers. It is in that basis that this government was elected into office. Therefore, it's a commitment that they must keep. We do think from where we're sitting it's possible. These are workers that are out there as we speak, and means they must be made to make sure that they are absorbed.
All right, Deputy Secretary General of NEHAWU, they're joining us on the line. December Mavuso, we do appreciate your time and thank you very much for coming through.